I'm Steve Dale for the American College of Veterinary Internal Medicine. Dr. Carly Jo Vanella is a veterinary neurologist. Myasthenia gravis. Some of us have heard the name because it's one of those things, like so many of the diseases dogs and cats get, people get it too. Explain what this is.
It's actually one of the more common neuromuscular diseases that we see in dogs and cats. We see it in a congenital form as well as an acquired form. So some puppies can be born with a defect in the receptors in their muscles. So their nerves and their muscles don't communicate as well. They start to show symptoms when they're a few months of age.
And the symptoms might be?
It's generalized weakness, difficulty moving, difficulty lifting their head. In older patients, when they get the acquired form, it's actually an immune-mediated disease. And just like in people that get immune-mediated disease, what happens is their body actually produces antibodies to the communication centers between the nerves and the muscles. And so what happens is when that communication fails, they start to get weak. Typically, you have a generalized form where you might notice you're out for a walk with your dog and they start to get really tired and have to lay down. And after a few minutes of rest, they get back up. They walk maybe for a shorter distance and then again tire very easily and have to lay down again. And progressively throughout that walk, they get more and more tired. In cats, the weakness often presents as just an inability to lift the head or a walking that's more of a crawl. But it can present in a lot of different ways, and sometimes we have animals that come in and they're seen by a cardiologist to rule out collapse from heart disease, or they're seen by an orthopedic surgeon because they're not wanting to walk and they think it might be a knee problem. But in general, that weakness is really the biggest symptom that we have. The other thing that we can see with the disease, which is a more serious complication, is a weakness of the esophageal muscle, which leads to something called megaesophagus. So the tube that goes from your mouth to your stomach actually dilates and the food sits there. And what owners will notice as the first symptom in that situation is them bringing up the food again shortly after eating. And when that happens, it can be a very risky situation for development of pneumonia and other things coming into the airways. And so that's one of the more serious signs that we see. But it's a strange disease because it depends on which muscles are weak. And so sometimes it can be something as simple as a change in a bark or a change in a meow because the muscles affecting the voice box are weak. Sometimes it's something like they're not blinking appropriately because the eye muscles actually get affected. So it's a weakness, but again, what you see in your pet really depends on which muscles are most affected.
So how do you, so maybe they've gone to other veterinarians, including other veterinary specialists first. They can't find what's going on. They can rule out what it's not, but they can't say what it is. How do you say what it is?
Well, what we do is when we see them, sometimes what we see clinically as a neurologist, because we're looking for these diseases, we can very easily say this is characteristic for the disorder. There is actually a blood test that we can do to look for those antibodies. So it's not very invasive. We collect a little bit of blood and we can send it to a laboratory that will be able to tell us in dogs and in cats whether that patient is affected. There are some other tests that we can do while we're waiting for those test results to come back that will help us know whether it's appropriate to start treatment in the time that it takes for that test to be run. And there is a test called a tensilon test that is often done. And what the vet will do is take an intravenous injection of a very, very short-acting medication, and it will reverse the weakness effects of the disease. And so you'll have a patient that can't walk that will suddenly, after a few minutes, be able to get up and walk around the room. After a few minutes, that drug wears off. But it's enough of an indication for us to go ahead and start treatment while we're waiting for the definitive confirmation test. It's not 100%. There are going to be patients that have other diseases that may still respond. There may be some patients that have myasthenia gravis that don't respond very well. But if they are responding, at least we know we can start treatment while we're waiting to look for the antibodies.
Okay, so once you've identified, all right, this is the problem, we know what it is, what is long-term the outlook for these pets?
Well, there's a few things that we want to focus on. One is just their general health and well-being. And for that, the first thing that we really want to encourage owners to do is get chest x-rays, because there are some disorders of the thymus gland, which we can see. That's part of the immune system, and it's associated with this disease in some patients. So we want to evaluate that. More importantly, those allow us to see if the esophagus is dilated and affected, and if there's any kind of pneumonia that's already present. If it's present, we definitely want to be very aggressive about treating that.
Is it usually an aspirate ammonia?
An aspiration pneumonia,
Right.
absolutely. So it's because they're bringing up that food and they accidentally inhale it. The other thing we want to focus on is trying to improve their strength. And there are some drugs like Myasthenia that you can give at home orally, and it doesn't treat the underlying disease, but it's a symptomatic treatment. So it helps the nerves communicate with the muscles enough to let your pet move around more comfortably. And then the third thing, and the most important thing long term, is to try to actually control that immune response that is responsible for the problem. And so we use steroids to suppress the immune system and a couple other drugs as well that can be used to create minimum side effects while we're suppressing the immune system and actually stopping those antibodies.
So particularly when it happens in a very young animal, is the prognosis a good one today, now, with what you can do as a veterinary neurologist?
For congenital, for those animals that are born with problems in their receptors, unfortunately it's not very good. However, for patients that develop the immune response, we actually do have a lot of successful treatments. Usually if we treat them within 6 months to a year, a lot of these patients will actually go into remission. And we do test the blood every few months and see how their antibody levels are responding. So we actually have a way of measuring the success of our treatment.
So it's not completely good news, but there's a lot of good news there.
Yep.
You can learn more at acvim.org. That's acvim.org.